When the pandemic hit, our community just froze. They don't know where to go, what to do, no emergency plan, no resources.
People in my community, specifically in Afghan community, they were not aware of what COVID is, how to prevent from COVID, and what causes COVID. There were lots of challenges, lack of information, and also lack of access to the resources.
We already knew when the pandemic was starting who would be most negatively affected. We have particular geographic areas and communities where we have majority or supermajority Black and brown populations that have worse health outcomes and not the same level of opportunity. And we have tried to really address that from the very beginning. But with pandemic, it was a whole new scale, and we had to develop a whole new set of systems and teams. And a key component of that was early in the spring of 2020, we also started the Community Navigator program.
Community Navigators are a group of community representatives that are working with Office of Equity and Partnership and Public Health King County. Basically, we are like a bridge of connecting the community with the resources, whether it is health related resources, rental related resources, food related resources.
We have about 30 community navigators, and it's a group that represents some of the hardest hit communities within King County, having a seat at the county table.
We had representation from the different Southeast Asian communities, the Latinx community, the Native community,
The Black African American, the Indigenous of Americas, Garifuna, Khmer, Thai, the Chinese community, the Vietnamese community. At the beginning, the purpose was to get information to community regarding COVID. Food access was a consistent theme, language access, digital access, work access, being able to take time off work, transportation was another one.
The language barriers in our community is huge. Over 70% of our communities does not have the technology or the digital literacy to really access those resources when everything went online. Some of elders, they don't even know how to even call to navigate the phone trees. As a community navigator, we're able to bridge that communication gap and help them to navigate the system. When we were able to gain access to schedule for the vaccine, we make an appointment for them, arrange transportation or drive them ourselves.
As the other communities, my community were also not willing to get the vaccination because they were questioning that how come this soon the COVID vaccination was produced. And what if it is harmful? Maybe it has chips in it and they're tracking us, or maybe it has some ingredients which is not cultural or religiously appropriate. A community navigator is needed because people cannot trust the system directly. So a community navigator is someone who they can trust first. I'm an Afghan and I'm also a community member. I am much more familiar with the culture that we are sharing, with the religion that we are sharing.
Having that trusting relationships with them, it goes a long way. There's more of, the personal touch. You do it from the heart. It's not about the numbers. It's all about the people. And I think having us being part of public health, it makes it more meaningful. Our community is better off, their well-being is improved.
There is always a need of a person from the community to just get all the information which is needed to the community and also bring the community's problems, what they are facing, to just advocate for that.
What was important to those of us in this task force was that it was a two-way street. We at Public Health need to hear from the community how we can better support you.
A lot of policies happen where there's no community input. The approach that's worked for us in the pandemic is bringing community in to help give direct responses towards different policies that the county is trying to make.
Working with community navigators is not always easy, just like working with community is not always easy. They ask tough questions, they put us on the spot. Community wants to see more. faster. That's very healthy tension for us to be in. You know, we talk a lot about using the pandemic as an opportunity to do things differently, to actually be true to our equity intent. And I think the Community Navigators is an excellent way of doing that.
What makes me do this job is because the community really needs it. Even if the pandemic ends, there are lots of other needs within the healthcare system. There are lots of other limitations or barriers that the community members faces. Who they trust to mention all what they feel or what they are going through. This pandemic will not be forever. This hardship will not be forever. This time will pass, but my service will be there for those who really needed it in this really hard time.